class 2 correction, okay? Overjet correction. We're gonna be talking about twin block therapy. And twin block is a key appliance I like to use in growing kids. Now, if you want success with this appliance, and this is the lower and this is the upper, okay, you need to pick your patient wisely. By picking your patient, first of all, you need to pick a patient who has overjet, of course. I'll show you like a good patient. Okay, so this is what this patient looks like. Okay, this is a great patient for twin block therapy. You know, half to a full cast class 2, growing patient, has overjet, in-mex dentition, not permanent dentition. What else? In terms of skeletal maturity, you need to do a skeletal maturity assessment, okay? So that means you need to measure and make sure your patient is still growing. How do you do that? You can't just guess. You can't just say, are you still growing? Because this thing is not gonna work, and this is gonna be a complete waste of time if you do not choose wisely. So the best way that I like to do this, and you can ask a lot of questions, but is to go ahead and do a hand-wrist analysis. And I've done a separate video on this. If you have a ceph plate, it's very easy to do. If you do not have a ceph plate and you can't do this, then you're gonna need to ask a lot of questions about skeletal maturity, where they are in the puberty process. They need to be barely started, you know, on the early end, not already completed. They shouldn't have had their menses, they shouldn't have their voice changed, they shouldn't have anything like that, not even close, okay? If you want this to work well. So also let's talk about psychosocially, what is the ideal patient for this? So I don't like to do these kind of appliances that can be a little bit bulky in a patient who is in junior high. They need to be still in elementary school. So you need to ask the questions. Don't assume because they're in 6th grade that they're in elementary school. They may be in middle school. So this is best in a 3rd, 4th, or 5th grader, okay? Even 2nd grader, any of the above. You can do this very young. It is not at all gonna work in junior high because you can see how bulky, I mean, even though from the front, you can barely see it. You know, this is what it looks like from the front. So that part is nice, and it is in 2 pieces, unlike your bionators and your Frankel 2s and other things that are in 1 piece and really affect speech. But it's still a little bit bulky. There's some acrylic blocks on it, and vertically, you know, they're gonna be talking and their speech is gonna be a little bit different. People will notice, people will be asking what's in your mouth. They can practice, they can probably get 90% improvement with speech, but people will still know. And it kind of gives you a little bit of a long face appearance. So even though this isn't permanent in junior high, it's just not gonna get worn. It's not. I don't care how great the kid is, it's just social suicide. So pick your patient wisely, right? So we said mixed dentition, just starting puberty or early in the puberty process, 3rd, 4th, or 5th grade. Skeletally hasn't gone even close through puberty left yet. And we're gonna leave this in actually about a year, 9 months to a year. It's gonna be in a pretty darn long time. So you need to make sure it fits well. As new teeth come in and out, you have to be ready to adjust it as needed, okay? So that's pretty much how it works. You're gonna go ahead, take your impressions or your scans. You're gonna ask for a twin block. These little acrylic blocks, okay, are going to keep the mandible positioned forward. So you can see how they're gonna have a little bit of an open, you know, open mouth like this. It's gonna give them a little bit of a different look. They're gonna talk a little funny. But this constant forward position of the mandible does encourage a deficient mandible to grow over time. It's not just smoke and mirrors. It actually will grow if the patient does wear it. That means 24/7 for about 9 months to a year, okay? If they don't wear it 24/7, 9 months to a year, it's not gonna work at all, okay? So then it's a waste of everyone's time. So of course, like with anything I tell you, make sure you have your compliance paperwork in check. Make sure you've created a compliance program. If you don't know what this is, feel free to connect with me. This is something that we do routinely with our concierge patients, concierge clients. We help you set all this up so that you can do removable appliances and not get dinged if the patient isn't compliant. Like you have all your systems in place. Of course, you're not just gonna let the patient go either. You're gonna be having them check in. You're gonna be measuring the overjet and making sure it's working. Within 3 months, if you don't see a kind of a noticeable change, they're not wearing it. So you might as well discontinue it, you know? So that's pretty much it. If the patient has a Deep bite, you might need to do some modifications. That means you're probably going to want to draw some of the acrylic behind the block right here, or some of the blocks behind the curved part, okay, so that the lower teeth can start to gently extrude. Same thing, you might want to take off a little bit under here, okay, and maybe even reduce it a little bit forward of the notch here. So slowly it can start to level out. But for the most part, this is a great appliance. If they do wear it for that 9 to 12 months, you can anticipate 3 to 4 millimeters of jaw growth, which is a pretty sweet class 2 correction. And the rest you can always get with elastics later in your braces or aligners. So this will reduce to eliminate, if you start early, the need for jaw surgery or tooth extractions. So that is the why behind the twin block. All right, thanks so much. If you have any other questions, don't forget to visit StraightSmileSolutions.com. Subscribe to us on YouTube. Make sure you go to our webinars, which are free. We have lots of prizes we give away.